Hello friends, today we will talk about a criteria named as NEXUS criteria. I repeat, NEXUS, NEXUS criteria. So this criteria is ultimately used for the C-spine clearance, and it is quite oftenly seen in ER setup as well as in MRCM exams. And for this NEXUS criteria, we have a mnemonic called NSAID. So based on the mnemonic, I will teach you what is NEXUS criteria. So this is the NEXUS criteria. So for this we have a mnemonic called NSAID, and N stands for focal neurologic deficit, and S for midline spinal tenderness. In this you can find the tenderness around the nuchal ridge to the prominence of the first thoracic vertebra. And coming to the A, there is altered level of consciousness. That is if patient is having a GCS less than 14, if the patient he or she is disoriented to time, place or person, and if the patient is inability to remember 3 objects at 5 minutes, and if the patient is having a delayed response to the external stimuli. So all this comes under the altered level of consciousness. And coming to the I, that is intoxication. Physically, if there is any order of alcohol or a slurred speech, ataxia if it is present, and intoxicating ingestion if the patient is having any history of intoxicating ingestions. And coming to the D, there is distracting injury. See, this distracting injury, it is a condition which distracts the patient from the cervical spine injury. So you have to elicit the history. This usually seen, for example, if the patient is having any long bone fractures, if the patient is having visceral injuries, if any large laceration is present, or degloving injuries, or any crush injuries, and also in case of if it is an extensive burns. See, all these are like a distracting injury, where the condition which distract the patient from the cervical spine injury while taking the history. So based on the mnemonic NSAID, so all this comes under the criteria. So main ultimate goal of this NEXUS criteria is for the C spine clearance. This is quite oftenly followed in the ER setup as well as in MRCM exams. So do read about NEXUS criteria. Thank you.